Hi, good afternoon. I'm Dr. ANSHUMALA SHUKLA KULKARNI from KOKILABEN DHIRUBHAI AMBANI Hospital in Mumbai. 28th of May is marked as the World Menstrual Hygiene Day across the world. This was brought forward in 2014 principally to make people aware and accept menstruation as being a normal function of a woman and not have any of misconceptions or have any kind of bias towards women when they're having menstruation. Women themselves have a lot of misconceptions, a lot of myths about what a normal menstrual cycle should be and what kind of a hygiene is required when you're having when you're menstruating. Let's start with what's a normal menstrual cycle. It's usually between 2 to 7 days. So it varies between people. It cannot be the same for everyone. And, the flow could be from a pad or 2 in a day to 3 in a day, but not more than that. So anyone who's having bleeding even up to 5 days or 7 days is acceptable as normal. It usually starts at the age of 10, 11, 12 years in these times and goes on for average of up to 50 years of age. That's the average age. Some people stop earlier, some people have it little later. So when you are as a mother or as a woman, when you start menstruating, what are the hygiene aspects that you need to be careful about is what I would like to speak to you today about. There's a lot of query about whether it's okay to use cloth, whether you should use this kind of sanitary napkin, that kind of sanitary napkin, or even tampons, or even the use of menstrual cups. So let's be, usage of a pad is obviously far more healthier as compared to using of a cloth which is being reused simply because of the ability of having it cleaned well. However, there is a lot of people in rural India who would still want to use a cloth, but they would wash it well and sun dry it before you use it. Sanitary napkin, there are lots of them that are available, but you could use even the pure cotton ones if you are someone who's allergic, to the synthetic ones which are probably more drier and make you feel more comfortable. Tampons are generally reserved for people who've been sexually active. They are very good because they don't allow spillage of menstrual blood outside. However, it's a very important point to remember that the tampon should not remain inside for more than 3 to 4 hours at a go. So you don't sleep overnight with a tampon in the vagina because that can cause a very serious infection called as toxic shock syndrome. So tampons are also brilliant. And the latest that has been there and has been adapted, and those who use it swear by it, is what is called as a menstrual cup. Now this is an absolutely environmental friendly option where you are using a menstrual cup which is to be inserted. You have to learn it a few times to get the hang of it, but it basically forms a suction inside the vagina and collects all the menstrual fluid inside that cup, which can be then removed and discarded into your toilet bowl without having to use any disposable sanitary napkins or cloths that need to be cleaned. And because it has a good negative pressure inside the vagina, it doesn't allow spillage to occur either. It's very important to educate younger girls to know that they must use their pads not more than 3 to 4 hours at a go and must change it as frequent as possible. And of course, using of a vaginal wash cream are available, a few of them are available, is advocated at least once in a day to keep the area's pH balance well. You never need to actually clean inside the vagina. So you never need to really go ahead and clean inside the vagina like a douching, which was popular some years back, because that actually leads to more infections. Vagina cleans itself very well. All you need to do is clean the outer aspect well, keep it dry, and keep it clean. Now, menstruation has a lot of issues. It can be delayed, it can be frequent, it can have spotting, it can have heavy bleeding. A lot of them are hormone-induced changes that happen which cause you to develop irregular period cycle. In younger girls, especially when they've just started their menarche, you'll often find that women have very infrequent periods. The girls would have very infrequent periods because the axis or the signaling that comes from the brain to the ovaries takes a little time to get matured. Until that happens, they would often have irregular bleeding, but all you require is assurance, maintenance of good eating habits and exercise, and then the menstrual cycle just comes back to normal. Particularly in the time of lockdown, I would like to mention, because we are now locked in at home, we are not physically as active as we otherwise would have been. We don't have access to the gyms or for long walks. We are also tied at home and tend to eat more than regular amount of food, which can lead to a hormone imbalance, causing a lot of irregularity in periods. So we're getting a lot of call of patients who are having either delayed periods or multiple periods in a month. But these are all related to the fact that your ovulation is getting disturbed because of the lifestyle changes that has occurred. Of course, stress also plays a very major role, where again you would miss or skip your periods because you just didn't produce an egg because of the extreme stress that you're feeling. So it's important to during this lockdown period, while we are here at home, to make sure that we are eating a regular healthy diet, being very conscious of what we eat, and exercising as much as we can at home. At least 20-30 minutes of either a skipping or Surya Namaskar or functional exercises, floor training exercises can be done at home, so that we ensure that our hormone cycle remains intact. So in short, World Menstrual Hygiene Day is basically to spread the word around that menstruation is not a taboo topic. It is not something that we need to be ashamed of. We need to be very hygienic, clean, need to use the appropriate method for keeping ourselves dry and clean, and making sure that we are keeping our lifestyle healthy so we have a normal menstrual cycle. Thank you very much.